you.
Hi, my name is Mike Hori. I'm an infectious disease doctor, and I'm head of the infectious disease section here at Valley Medical Center, and also co-chair of infection control. My associate over there is...
Hi, I'm Brick Wall. I'm the medical director of the critical care unit. And Mike and I are here again to answer some of those tough questions that you have submitted online. But first, Mike, I have a question for you. I noticed you're wearing a mask. What gives?
Our experts at the CDC have suggested that people wear masks when they're out in public in areas where they can't socially distance. For instance, if you happen to be in a store where people are close together, or in some other setting where you just can't get that distance to keep the virus from jumping to you. And, it's probably a good idea. You can see here that I have a lovely mask that my wife has made. She's actually made several of them and given them out to other people within our hospital here. And it's probably a good idea, but the question is, how do you treat your mask? And what is the real reason we're doing this? So the reason we're actually being asked to mask is not so much to protect ourselves individually. I think that the information that science gives us about that is kind of so-so. What the real reason is that we're asking people to wear masks for is that people who actually might be incubating the actual viral disease, the coronavirus disease, this may help reduce the risk of spreading the disease to other people. So with that in mind, you want to make sure that your mask stays dry and it stays clean. Because otherwise, if the surface is contaminated and you touch that and touch other surfaces, you may actually be spreading the disease despite the fact that you're wearing a mask. So my thought would be that if you notice that your mask is wet, you probably need to replace it. If you notice that your mask is soiled, you probably need to replace it or wash it. I think it's probably a good idea if you could just wash it once a day. The coronavirus itself is not a very hardy virus, so a normal wash cycle or a normal detergent probably would work for it if you do wash it once a day. You also want to be very careful about how you handle it when you actually have it on. You always want to be able to wash your hands before or after you touch your mask. That's very important because if you do have coronavirus, your mask actually might be contaminated. And if you are touching it and then touching your environment so somebody else might touch that same area and contaminate themselves, you're actually defeating the purpose of using the mask. So those are some of the things that I would recommend when you're using a mask. And remember, the real reason why we use these masks is actually to protect other people from you if you should happen to have the problem rather than the other way around. I think it's effective, but you have to be careful about the way you use your mask. Use good hand hygiene. Wash your hands when you're playing with it, and wash it if it doesn't look right.
So Mike, I noticed you got a haircut now that you took your mask off. Is your wife also your barber, or are you not practicing?
Yeah, my wife is my barber. She put me in a black plastic bag and used appropriate PPE, which was a mask and gloves in this particular situation for this particular instance. And she is doing quite well. She has done this about a week ago, and she remains asymptomatic.
So she makes masks and cuts hair. You've married well.
Right. She's also made me a nice gown, which is reusable. And now I have her working on making head coverings for our ICU and 5-cell staff. Excellent. Who are working with our COVID patients. So she is very industrious.
Well, so we're here to answer some of the online questions that our staff have submitted. So I'll start with this first one. It says, for people who use a CPAP machine for sleep apnea, is it safe if I have COVID symptoms to use it at night? And is it going to push the virus down into my lungs? Kind of an interesting question. I think there's a couple answers in there to unpack. The first is it going to push the virus down into your lungs? I would say I'm not really worried about that because the virus already exists in your lungs and in your secretions and in your saliva. So it's not going to increase your viral load per se. However, machines, nebulizers, BiPAP machines, CPAP machines that nebulize air can temporarily make this virus aerosolized and airborne temporarily. So if you are on a CPAP machine and you are either symptomatically shedding, or we recognize there are some asymptomatic shedders, you could potentially be putting out a fine little mist of coronavirus particles into the sphere around your head for probably a few feet, and there's a constant aerosolization. And so I guess there is a risk that you could actually put people around you at increased risk, although presumably if you're coughing and you're symptomatic, you probably have contaminated every contact surface within reach anyways. But in the hospital, I'll tell you, we are recommending that people who are COVID positive be placed on airborne if they want to use their CPAP or BiPAP machine, simply because of the concern that they may actually increase the dispersal of the coronavirus. But actually, to the original question, could it drive the virus into my lungs? I'm less worried about that.
Okay. Here's another question. If I have COVID or think I have COVID and I'm taking care of myself at home, how should I treat my symptoms? Is it better to take Tylenol or Advil? Well, it's a viral illness. Sadly, at this time, we don't have any specific treatment that we can give you. The experimental treatments that we're using in the hospital are probably not things that we're going to recommend for people to use at home if they feel well enough to stay at home at this point. So we're basically dealing with the typical things that we use for viral illnesses. Rest is certainly one of them. I've heard over and over again that in the time of COVID, you don't have to be productive. And particularly if you're sick, you don't have to be productive. Stay at home, rest. You can keep up with your fluids. If you're having a fever, you're losing a lot of fluid, what we call insensible loss. So you do need to keep yourself well hydrated so you don't get behind in that area as well. There are some fairly specific symptoms that are related to COVID virus, in particular fever. It's been found in up to 90% of patients and can be pretty hard to treat, actually, from what I understand. Tylenol would probably be the thing that we recommend the most for this particular problem. There is a bit of controversy for drugs which we call non-steroidal anti-inflammatory drugs, which are drugs like ibuprofen and naproxen, drugs that go by the trade name of Advil or Aleve. At this point, if you look at the CDC site, they would probably recommend that that would not be your foremost way of treating your fever if you can possibly help it. The data for it, though, is not that strong. So as far as I'm concerned, if you're somebody who normally takes these medications for underlying problems like severe arthritis or something of that sort, I don't really think you need to stop them for this particular purpose, but I wouldn't add them for symptom management. The other really annoying thing that I hear about this is cough. It can be pretty bad. There are a number of cough medications over the counter. The ones that contain dextromethorphan might be useful for you. Or this might be one area where you may want to check with your doctor. Call him. Don't necessarily wander down to the clinic. And ask them if there's anything that that will help them if the over-the-counter cough syrups don't help. There may be something there that they can also recommend to help you with that. So those are the major things. I think that from a standpoint of staying at home, it's a good idea for these sort of illnesses. We are still recommending that if you are concerned about having a contact with a COVID patient and you are ill, but don't feel like you need to be in the hospital, you might want to stay home for at least 72 hours after the symptoms resolve before you go back out in public on a regular basis. Ooh, touch my face. If you start to get feeling like you're getting short of breath, that might be something you might want to be looked at, which is another regular problem associated with disease. I think, feeling kind of mildly short of breath is not uncommon. The symptom that most people complain about is feeling like they have chest heaviness. But, if you really start to feel like it's hard to be able to get air in you, then that's when you need to go be looked at. So, Rick, thoughts about what happens? Go ahead.
I was going to say, Mike, that actually fits perfectly with another question that someone submitted and said, how do I know if I should take my sick loved one to the emergency department? I think, you alluded to that, definitely if they're getting short of breath, if there is something going on in the chest where they are winded, not breathing well, they should probably consider going. But I think you and I would both agree, if you just have a little bit of an ache or a sniffle or a sore throat and you don't think you need to be hospitalized, basically is what it boils down to. If you don't think you're going to get admitted, I would encourage you to stay away from the emergency department. Would you agree with that?
Yeah, I think so.
It's a change from what we've done. I mean, historically in a pulmonary clinic, someone called me with a cough and symptoms and they wanted an antibiotic. And a lot of times I say, come on in. I want to look at you, listen to you, sort of hear your story, maybe get an x-ray. But it's a very different world we're in. Over the last month, we've gone sort of the other extreme, which is let me call you and do this over the phone without you coming in here and potentially spreading virus, or if you're not sick, worse, getting it from someone else. So we really are trying to limit social contact, not only on the streets and in the stores, but actually in our clinics.
Great. Thank you so much for that information, you guys.
All right. You're welcome.
Thank you.
Bye. Next time, I